Welcome to Ascend Growth AI podcast. I'm Nikki, and today I'm excited to welcome Glenn Loomis. Glenn is a physician, entrepreneur, and problem solver who spent his career operating at the intersection of medicine, leadership, and innovation. His work focuses on improving outcomes while navigating the very real challenges of growth, operations, and adoption of technology in healthcare. I'm really looking forward to this conversation. Glenn, welcome to the show.
We're excited to talk to you today.
Very good. To start us off, can you tell us about your company and the journey that led you to where you are today?
Yeah, my company is called Query Health. We've developed an AI doctor agent that talks to patients and takes their history and tees it up for the provider so that the provider basically has everything about you ready to go when they walk into the room. And it also gives them a diagnosis and treatment plan and that they can use or not use depending on how they want to do it. And this started a long time ago for me. Almost 9 years ago, I actually started doing a project with IBM. I don't know if you remember IBM Watson, that was on Jeopardy, but we actually tried to create an AI doctor using Watson back in the day, and it just really wasn't up to the task yet. But, you know, fast forward a few years in 2024, the end of 2024, really thought that the new LLMs could do the job, the new generative AI. And so took a swing at it, and lo and behold, we were able to actually create the thing that I had envisioned.
That's fantastic. I think that the AI innovation in healthcare helps the doctor like cut down on some of the busy work so that they can actually look at what the AI produces and then modify it to what they think override where they want to, but allows them to not spend so much time on the ancillary part of a diagnosis, probably lets them dig in a little bit deeper because they've got time saved and more time to spend on the important parts.
That's exactly right. We figure that about 50% of your time in a visit as a physician is spent sort of bringing out the data from your patient, whether that's looking it up online or whether that's talking to them and trying to extract the things that you need to make a good decision about them. And so, one of the problems, my background is running health systems and medical groups for a very long time. And so one of the problems we have is that doctors really don't scale, right? We're still sort of doing things the same way. I mean, I saw when I was in Egypt, things on the pyramids that said that they were kind of doing things the same way 4,000 years ago, right? We still question patients the same way. We do the same kind of thing to get to a diagnosis. And there's really no way to scale a doctor. We just sell our time, right? And so now we have a tool where we can actually have AI do a part of the visit for the doctor, tee up all of that information, have that conversation with the patient. The patient gets to have a longer conversation. They can get all of the story out that they want to tell because, the AI doesn't care how long you talk to it. It'll talk as long as you want. Doctors typically will cut you off after a certain point of time. So we get all of that information, tee it up for the provider, give it to them, and then they do what they do best, which is a physical exam if they need to. And then they do that diagnostic and treatment piece by looking at the things we tee up for them and saying, oh, that makes sense, or oh, that's not exactly right. Using their judgment and their knowledge to give you the best possible outcome. And then take that time, that little extra time that they haven't been able to take lately to actually coach and, cajole and, get you to do what they need you to do in the way they need you to do it. So we think that's a better way to make doctors both more efficient, but also more effective.
Sure. My mom is older and I go with her to her doctor visits and she wants to explain. And I'm looking at the doctor and I'm listening to my mom. And I'm like, Mom, I know he appreciates all your story, but he just needs the facts right now, which for an older person is almost a little bit offensive because they want you to know. So I think that's a great way to let them, again, say everything they have to say, tell all of the story that goes with it, and then lets the doctor be the doctor. I'm
Yeah,
sure that's a winner.
exactly. And the AI actually does a really good job of parsing through all of that stuff, creating bringing out the pieces that need to be brought out, leaving the rest of it in the transcript. If you want to, if the doctor needs to go in and see the full story, they can. but at least they've got all the facts because you'd be amazed at how often we leave out facts when we cut people off. We miss important little details. And so this is a way to get all those details in and get the information that the doctor really needs to make a great decision.
That's a huge one. I love it. Looking back, what were some of the early moments or decisions that shaped the direction of your career now?
I've always been the kind of guy who just says yes, like, so I've gotten thrown into a lot of things. I started in the Air Force and, got thrown into leadership pretty early and then was in teaching family medicine for about 10 years and ultimately was a residency director. But and then ultimately started running clinics and being part of the leadership team for health systems. And during all of that time, I've always kind of been the IT guy, I guess. I've implemented Epic a number of times. I've implemented Cerner, a lot of other EHRs, a lot of other IT systems. And eventually I even had the innovation arm of the health system I was in reported to me as well. So really looking at all kinds of interesting technology. And so I think for me that I've always been at that intersection of medicine and technology and innovation, right? Like that is where I function best. And I just have a lot of curiosity, or maybe it's a attention deficit disorder. I'm not sure, but I like to really understand things. I like to get in and understand why. Why does it work? Why is it not working? And try to figure out how do we do things better? Like just because we're doing it this way doesn't mean it's a good way to do it, right? We've done things maybe for hundreds of years this way, but maybe there's a better way that we could do it. And so that's my passion really is trying to problem solve and figure out better ways to accomplish the job and make people more efficient and more effective.
How would you describe your leadership style today and how it's evolved over time?
Yeah, it's a great question. I think if you asked my people, they would describe my leadership style as inspirational. I tend to have a big vision. I tend to do a good job of communicating that vision. And I tend to try to put the marker out as far as I can get it without everybody going, well, that's completely impossible. But at least make it far enough out there that they're excited to see if we can make it to there. Right. And so it's evolved a lot though. I mean, like all doctors, I think we're all micromanagers by, just by nature. And so I think I started out much more in that realm when I was young and, thought everybody should do things my way. And I've very much learned that that's not a great way to run things. It's not a good way to build a mousetrap. You need a lot of different people with a lot of different skill sets, a lot of different ideas. And your job is to take all those and mold it into something coherent. And so I think I do a lot better job now of giving people a vision, let them do it their way. If they're floundering, then I can come in and say, hey, I know a good way to do that. Let's do it that way. But I try to let people, have their own way of doing things. I want them to get to the outcome I want, but they can do it their way. And I think people really enjoy that from a leadership style.
You give them the opportunity to shine, and that helps them shine brighter and makes you better.
It's funny. One of the things that I always tell my young leaders because they instinctively want to do the opposite is go out and find the smartest person that you can to work for you. Hopefully they're smarter than you, more talented. And because one of two things is going to happen. Either they're going to make you look so good, you're going to get promoted and they're going to take your job or they're gonna outshine, they're gonna come to a point where they wanna leave and go somewhere else and take a job like yours. Either way, we win, right? If you get people who aren't as good as you that you think are gonna make you look good, they actually drag us down. I read, somebody said, if you have an A player and they bring in a B player and they bring in a C player, pretty soon the entire organization is full of D players, right? And so we don't want that. But that's a hard thing to get young leaders to understand and do is, find the smartest people, find people that you think are better than you, because ultimately they're going to make you look good.
Absolutely. I always say the leader needs to be the weakest link, and then you'll have success.
Yeah, that's a good way to put it. I've never heard it that way.
What lessons did medicine teach you that translated unexpectedly well into your leadership and business?
Wow, that's a great question. I think one of the things that it teaches you is how to diagnose a problem, right? I mean, that's what we do every day, all day long as physicians. And I think it's also a problem for us as physician leaders is we want to jump right to diagnosing the problem. We want to jump right to that without always extracting all the facts first. You have to learn to be a little more patient, right? Because in medicine, maybe you're in an emergency room or in the hospital and things are need to go quickly or somebody might die or somebody might become even more sick. And so you get in this thing where you're in a little bit of a hurry. And so one of the lessons I had to learn that I didn't learn from medicine is to not be in such of a hurry. Leadership, most likely nobody's going to die tomorrow if we wait to make the decision. And honestly, some problems sort themselves out if you give them a little bit of time. And as a family doctor, I did learn that. I mean, I had a patient one time who elderly lady, she would come see me every week. I'd try to fix her. She wouldn't do anything that I said. And I literally said one day, like, why do you come and see me, so often when you don't do anything that I say? And she's like, you know what? I like you and you make me feel better. And I was like, geez, I needed to learn that lesson, right? Is like not everything needs to be fixed. Sometimes it just needs a little care and attention and it'll fix itself. So I've had to learn a few of those things along the way, but I would urge anyone to go into medicine, no matter what you might want to do down the road. It opens so many doors, it gives you so many skills, and it teaches you so many life lessons. And plus, it's sort of, from my perspective, it's the profession that has the most you get the most respect from people, and they tell you things that they wouldn't tell anybody else, and, it's a privilege to be a doctor. I don't really practice anymore, very, very little, but I still feel very privileged to have had those relationships, those interactions. Hopefully, I hear a lot of docs say, "Oh, I wouldn't do it again. I'd do it in a heartbeat," and encourage anybody out there to definitely go into medicine. There's nothing better.
Yeah. When you're helping somebody achieve something that they can't do without you and you see them light up as a result of you, there's a joy in that that people just you can't get in any other way. You're helping them be
Absolutely. That said, do I hate the paperwork that goes along with it? Sure. I mean, and one of my goals is to get it to the point where, you know, as a doctor, I never have to touch another keyboard. I can just talk to the patient. It'll all sort itself out. The orders will go out and everything will be done when I walk out of the room. Like if we get to that and we're almost there, that's the nirvana. Then the good part of medicine is all you're doing and you don't have to do a lot of this other nonsense that, the insurance paper shuffle and all that.
you get to stay in your superpower.
Exactly. I mean, we went to school a long time and we get paid a reasonable amount of money to do that, right? We didn't go to school to push papers around a desk and wait on hold and, all those things.
Was there a moment in your journey where things felt especially uncertain? And how did you navigate through that?
I've thought about, eventually write a book, and one of the things my grandma used to say is there's never a road so long that there's not a turn in it. And I have found that to just be so true. Like in life, a lot of the things that in the moment look like something terrible are really just a setup for what you're going to do beyond it. If you could see around the curve, you'd be okay. But in the moment, it's very tough. I mean, I was on the fast track to, the general staff in the Air Force. And then, I got an officer above me who, was all about weight. And I never made the weight standards when I went in, let alone any time while I was in. And so I could do everything else though, and so I ended up, getting this performance report that was like great officer, great doctor, groomed for command, too fat, leave, and I was just like, that seemed like a crushing blow, right? But it turned out to be a great thing later on. And so there's been a few twists and turns like that where in the moment you're very unsettled, but in the long run, a lot of times when you look back, you're like, that was setting me up for this. That was setting me up for that. Unfortunately, you don't have those x-ray glasses where you can see around the corner. So you just have to learn to take a deep breath and be in the moment and just keep on going. Perseverance is a real superpower if you can attain it.
Yeah. All things work together for good, right? Whether you're religious
Exactly.
or not.
You know, Whether you're religious or not, whether you believe in the universe or God or
Yeah.
whatever, there does seem to be a plan to how things work out most of the time.
Who's the ideal customer for your company today? And what specific problems are you best positioned to solve for them?
Yeah, so right now we're selling to small to medium sized medical clinics and urgent cares, people, who see patients every day in the office. That's really what we're set up to do. We will eventually move to the emergency room as well. We're not selling into health systems per se right yet because really trying to get our operations sorted and up to the level where we'll be comfortable in that kind of high pressure environment. Those are our customers right now, and we've just started installing it and, knock on wood, everything's going good so far.
Yeah, that's fantastic. Are there particular industries, patient populations, or business types that benefit most from what you offer?
I think right now our best use is in sort of urgent care and primary care. We are right now building the specialty agents to go into sort of all the major specialties, but right now primary care and urgent care are our biggest place. Moving forward, we'll also have more of a direct to consumer approach as well, but right now we're fully in the sort of B2B space, selling to doctors' offices, really trying to improve the experience for doctors and their patients in the brick and mortar environment.
What geographic areas do you currently serve, and do you have plans to expand beyond?
We're nationwide right now. We have plans to go to Europe eventually and perhaps other countries around the world. We currently are in Spanish and English, so any Spanish or English speaking country we could be used in. We have clients and customers in a few states already, so we're looking at any place in the US at this point.
Is it hard to translate it to other languages, or is that mostly because forms are only basically created in Spanish and English at this point?
So we did Spanish first because it's the predominant second language in the US, but it turned out to be surprisingly easy. The actual translation part is very easy. And so we actually have it set up where both the doctor and the patient can choose their preferred language. So in theory, we could allow any doctor in any language and any patient in any language to talk and basically be able to understand what came out of that interaction. The problem is our app, the biggest sort of time that it takes is actually to label all the little fields and things in the app. The actual translation of the words and the actual speaking of the agent in the language, that all is easy. AI has made that part surprisingly easy. Right now, we could get into essentially 80 plus languages if we had the sort of time, energy, and money to create the skins for all of that in our app.
I have a landscaper, and he does better when I text him all of my stuff, because when I speak it, the translation of words confuses him. So his response is completely different than what I asked. And I think in the medical field, way more important than my yard, to be able to communicate what they're feeling or what they're experiencing in their native tongue, where it can actually be translated into what's really happening. It really change a diagnosis, honestly.
Yeah, so it's funny in the translation piece, like when you're live and you have to use a translator or something, it really is very, very difficult. But imagine if the patient ahead of time can just talk in their native language, get it all out. You're still gonna have a little bit of a problem during the sort of part where the doctor is talking, but later, they have a copy of that in their app now, and they can see everything that you said, and they can see it in their language going forward, and so even though in the moment, it might not be perfectly clear what the doctor is saying to them, it will have been perfectly clear that what was translated that they said in their own language, the doctor is gonna be able to see that perfectly clearly, and later on, the directions and things like that, they'll be able to understand what the doctor said because they'll be able to see it in their own language. I think gonna really change some of the adherence problems that we have because like the problem is patients often just don't understand, and that not only in another language, but honestly, even in English. Like, imagine if you could go back and look at the transcript of what happened in the visit and say, "What did he say?" or "What did she say?" and look at it and say, "Oh, that's what they said," right? Like, now you're gonna be able to do that. I think it's gonna be a game changer for us going forward.
Yeah, 100%. So often you hear, at least in these beginning stages, that people are afraid that AI is going to replace them. And there's just so many areas that AI is such an enhancement in service and care and depth and quality to help people be able to navigate life. It's incredible. I mean, and this is one of those areas that it really is a missing gap. And so often someone goes home and tells their spouse or tells their child or their, what the doctor said. And now to be able to give them a transcript and say this is, and then they can read it and go, oh mom, or oh honey, I don't, that's not even what they were saying. It's really this. I mean, that's that's awesome. I don't know what word to use. It's amazing.
Yeah, so you if you think about it, right now, probably around 30, 40, 50,000 providers short in the US. That's just in the US. Other countries, they have, even way bigger problems, right? And so in 10 years from now, we're projecting to be maybe as much as 120,000 providers short. And so I don't think we have to worry about our app putting providers out of a job. I think it's going to serve as an early provider that triages things and gets you to the right person and, takes care of some of the easy stuff without you even having to go into the doctor. And in the long run, that's what it's going to do. And I think it's going to be enough to perhaps stave off that shortage so that we will be able to actually not have to put tons of money into training a bunch more providers, but do it with the group of providers that we have, we'll be able to take care of the whole population. And that's my vision, at least. I don't see it as a threat to, provider jobs.
And enhancing quality of life worldwide, which is amazing. What major trends are you seeing right now in healthcare and well-being that are impacting growth strategies?
I mean, there's a lot of trends. I think a couple of them are one, there's not enough primary care to go around. And so all the primary care docs are going to this sort of concierge type practice model. And, you end up having to pay cash for your primary care and that kind of thing. And it's either a good thing or a bad thing, depending on how you look at it. Right. I mean, it's tough for people who can't feel like they can't afford it right now. But it is a little bit freeing for the primary care doctors because they can feel like they are able to just be in service of those patients and spend as much time as they need to and those kind of things. And I hope we're going to be able to help those docs actually increase their panel size, maybe bring their costs down a little bit so that you can get that same concierge experience but maybe at a little different price point, and the doctors still may actually do even better from a financial point of view. So hopefully that's going to be how that works out. That's definitely a big one. There's a lot around compound medications, a lot going on with, using different compounds. Started with the GLP-1s for weight loss, obviously, that's huge, but there are a lot of other compounds in that same category that have interesting properties for well-being, I'll just say. And so I think that's only going to grow. I think the FDA is having a hard time figuring out how they're going to regulate all that. So we'll see how it all plays out. But I mean, those are some of the things that I'm seeing. I think that the other thing is just the continuing move of everything out of the hospital and into the ambulatory environment as much as possible. We're going to where hospitals eventually are just going to be large ICUs, and the rest of medical care is all going to be delivered in the ambulatory environment.
I think that's good for the population too. I think a lot of people would really appreciate that.
There are a lot of people that go in the hospital with one problem and end up with 3 or 4 others because there's a lot of diseases that run around in hospitals, right? And so you wanna spend as least amount of time there as you can, and that's coming from someone who did my best to make them as safe as possible, right? So I think the more we can keep people in their home, I would say the same thing about nursing homes, right? I think there's a push to keep people in their homes as long as possible, and I think that's a good thing. The more we can spend money on keeping people out of the hospital, out of the nursing home, and in an environment where, they can hopefully be safe and feel comfortable, I think those are the good trends in medicine for sure.
Which of the trends do you feel like are the biggest opportunity and which ones do you feel like are the biggest threat?
I think the biggest opportunity right now, obviously, is in the sort of AI and robotic space. I think there's just so much going on there. A lot of it's hype, a lot of it is not necessarily value add, but there is a lot that's value add to both providers and to patients. And so I think that's a huge opportunity. The threat, I think the biggest threat is funding is always a threat, but I think the biggest threat from my point of view is sort of there's too many people and too much expectation of care for what can actually be delivered right now. Goes into the opportunity, right? I think the opportunity is to take AI to deliver some of that and allow us to actually meet the expectations of patients with the limited, amount of people that we have. I mean, right now, it's hard to staff a clinic, right? I mean, MAs, there's not enough medical assistants to go around, there's not enough nurses to go around, and that means costs go up. And, so not enough doctors and nurse practitioners to go around either for that matter. And so, I think we just have to continue to find ways to make us more productive. And like I said, doctors just don't scale right now. And so figuring out how to do that, I think is the answer to a lot of problems.
Absolutely. What steps are you taking to mitigate those challenges while continuing to grow?
We're positioned to be a solution for a lot of those problems. So I think that's what we're attempting to do is as quickly as possible, get our solution implemented in as many clinics as possible, demonstrate that we can decrease the time per appointment by 50%, decrease the poor outcomes because we're serving up the best evidence-based data right at the point of care to the doctor. Eventually, demonstrate that we can actually reduce phone calls so patients don't feel like they have to call all the time because they have the information right in their hand that just came out of their visit. All of those things we're attempting to do, which is, like I said, decrease the need for more people and allow everybody to feel like they're getting the best care in the easiest way possible.
How are you currently using AI or data driven tools in your business today?
My business is all AI. So, in terms of being data driven, I mean, one of the things I didn't point out, we pull in. So if you are scheduled for an appointment, the first thing that we do is we pull in all the information about you that we can find in something called the Health Information Exchange, which basically goes out to all the health systems and brings in all their data into one place. So we try to get as much as is known about you so that when our AI is looking at that and creating a profile of you and then asking you questions, it already knows what your problems are, what your meds are, where that you were just in the emergency room yesterday or you were hospitalized 2 weeks ago. It already has all that in the back of its head, so to speak. And so it can then ask you questions that are relevant without having to ask you all of those sort of very detailed questions first because it has that already in. And so that's very much more engaging for the patient is like, oh, this thing already knows me, right? And so yeah, data is the lifeblood of what we do. Pulling in data from electronic health records, pulling it in from eventually from your wearables. We aren't doing that yet, but that is definitely on the roadmap. And then pulling it in from the health information exchange.
Are you a fan of the chip in the brain?
I am actually. I'm kind of excited to go there when, when Elon or whoever gets it figured out, probably sign up. For me, the problem is I've always had an extraordinary memory, but as you get older, you start to slip and I've never had a good memory for names. And the older I get, the more there's like a Swiss cheese hole for names that I can't. I'm like, well, who's that? Huh? And so I'd love it if I had the little memory chip back there that, could just tee it up for me that, hey, that's Nikki, whatever. So, like, oh yeah, I remember Nikki because I'm great with faces and I could tell you all about yourself if you were my patient,
Right.
but I have no
Right.
idea what your name is. You know,
Where has AI made the biggest positive impact so far?
I think so far the biggest positive impact for providers has been the ambient scribe because it's sort of a intermediate step where between having nothing and where we're going now with the AI actually doing a lot of the history taking. In the middle is the scribe where the doctor is talking to you and the scribe is taking notes and eventually putting it into a format that looks like what you did during the visit. So for providers, that has been a huge help because I can tell you when we went from paper to electronic health records, that was the bane of everybody's existence is how do we get data into this thing and all the typing and all the talking and all the whatever. So that's the biggest one there. I think there's also a lot of really good things happening in a different part of AI land, which is the machine learning part, which is looking at, you know, how to predict who's going to, who's at risk for dying in the hospital, or how to predict who might get septic, or, all those kind of things. Like those kind of prediction algorithms, I think, are getting better and better, and they have been super helpful in allowing us to stay ahead of things and say, oh, this person needs a little extra attention because they're at risk of something bad happening, right? And it really has reduced, morbidity and mortality in, especially in hospital settings, a lot. So I think those are two of the places I would say that it's really made a difference so far.
What do you wish AI could do for you that it doesn't quite handle yet?
What I want, and theoretically, there's glasses coming out shortly, is I want a peripheral brain that will watch my entire life. And when I ask it a question, tell me, the things that I've forgotten. Like, that's what I want. And honestly, when that happens, I think that will be directly applicable as a provider as well, because pretty soon we'll be able to not only have the patient interacting with the AI at home, but you interacting with that same AI in the office through some type of interface and be able to get cues about things that you should ask, or cues about things that you should do, or things that you should order, without you having to say things out loud that might be disconcerting to the patient. Like, you don't want the patient to, really think that you don't know what's going on, and so having that sort of pop up in cue when you might be a little bit lost or you might not remember something specific, I think is going to be super helpful as well.
My hope for you is that those glasses will tell you their name and
That
you
is
don't
the
put it in
most
your brain.
important thing right now, and maybe I'll skip the chip in the brain if the glasses will do it for me.
There you go. Facial recognition and then
Exactly,
up
right?
pops the name. If you blink twice, it knows that you're
Yeah,
looking for a name.
exactly.
Then you don't even have to ask it, it just is there. And you're not walking around with a bunch of
Yeah,
names
you
showing up
gotta
in
tell it that
your
that's, I think the glasses that are out now, they you have to wear some kinda ring on your thumb or something and do a little gesture or something. I don't know, I haven't tried them yet. I've seen it, I've been on the websites. I haven't yet pulled the trigger, but I probably will in the next, little bit.
That's great. When you think about growth, where do you see AI playing a bigger role in helping you reach more customers and patients?
That's a great question. I haven't really used AI a lot for outreach because we're still early and I'm reaching out to people I know and I can talk to directly. I do think that, you know, there's a lot of outreach that can be done using AI. So I think that will probably be, as a growth medium, it will probably be something we'll get into as my sales function starts to get bigger and need to expand and go further afield.
Yeah. What's working really well right now that you're especially proud of?
Her agent works really well. I'm super, when you have this idea, you build a prototype and you're like, oh, it's okay, but then when you build the first version and you actually see it work and you're talking to it and it's asking the right questions in the right order and it's giving you the right output, you're like, holy crap, we did it, and I'm really proud of that. I'm very proud of our sort of multilingual piece. I think that is going to be a huge winner. And I'm proud of a few other things that are coming but aren't quite done yet. So I'm very excited about what we built. I think it has the potential to change practice, but also to change patients' lives. Honestly, that's what I live to do, is to create better opportunities for providers and better opportunities for patients so that we can keep them well and you know at least keep people as well as they can be. We're all usually our own worst enemy by our, eating, drinking, exercise, et cetera, habits or genetic makeup. But, if we can at least optimize what people have within those constraints, I mean, It's as good as it gets from a doctor's point of view.
Absolutely. I think you're gonna have a huge impact on the world. Huge, because I do a lot of podcasts, and this is the first I've heard of this
Yeah,
angle,
I
and
mean,
this is
so
amazing.
when we get there, I'm very excited about the idea of actually taking this to totally underserved patients. I like to travel. I travel the world. And, when I'm in Africa or parts of South America, or they have no access to a provider, but they all have a phone. And so if I can put a virtual primary care doctor in everybody's hand in the world, and they could decide, oh, it's telling, they tell it the symptoms, and it goes, it's a cold, take 2 aspirin and call me in the morning. Or they're like, hey, this is a real problem. You need to get in and get seen as soon as possible because you might have X, Y, and Z. That I think is a huge winner because there's so many people in the world who don't. I mean, even here in the US, I mean, obviously my family is all in rural Michigan, Wisconsin, Ohio, and sometimes the advice they get is a little bit suspect, and they call me, and I try to give them, the best evidence-based, you know, things, and I'm thinking, like, what do people do if they don't have a doctor in the family to call, right? They just go along with whatever they're getting fed, right? And so if I can make those doctors more effective by giving them the latest, greatest, so that they're always giving people the right answer, and if I can actually eventually give it to the patient directly at home to be able to look at it and say, oh, well, this is probably what's going on, and I don't have to worry about it, or this is probably what's going on, I need to get right in. I mean, that will change lives, I think, and, very exciting from my point of view and why I do what I do.
Yeah. Maybe teach on your site, maybe give them like prompts, like say, frame your question this way so that when they're asking, they get the right result. I think a lot of people try to treat all of that as a, if I talk to you normal, it's going to give it to me, but it's only as good as how you say it sometimes. So I think it's good to cue people on the framework of how to ask a question so that they get the response, right?
That's the great thing about what we've built is it's not like talking to ChatGPT or Grok, right? It actually leads you the way a doctor would lead you, right? It asks you the right questions, and then it lets you say whatever you wanna say in whatever way you wanna say it, and then out of that, it says, "Well, I got these parts, but I didn't get these parts," and then it's gonna ask you those parts, right? It's gonna ask you the next question about that, and the next question, and the next question, until it gets all the stuff it needs, because in the background, what it's doing is it's driving towards a diagnosis. And so it's counting off, like, do I have enough to confidently make a diagnosis here or not? And so, whereas what happens right now is a lot of garbage in, garbage out, right? People tell ChatGPT whatever they want to tell it, and it'll give you an answer. And based on what you told it, that's a good answer, but it may not know your history. It may not know your meds. It may not know that you were just in the hospital. You may not have told it half the facts that it needed to know to make a competent diagnosis or a competent treatment plan. And so you're getting the best it can give you with the information you gave it, right? But that's not good enough. And so we want you to get the same kind of output that you would get if you were actually in a doctor's office talking to the best primary care doctor in the country.
Really excellent because that will make all the difference in the world in the communication. I recently I'm getting a hair test and I was filling out the form for the test and you have to type it all in, right? Even on this side, you get tired of asking me what supplements do I take? And I'm looking over at my supplements going, are you kidding me? Like, it would be nice just to speak it in there, and it would also be nice to say, "I don't take this all the time, I only take this sometimes," for it to so the person who's looking at that chart to not look at it and think, "Oh my gosh, she's taking all of that." It's like, really, you've only got part of the story, and that's how I felt when I filled it out. I was like, "Wow, I'm filling this out for you, but you really actually have no idea about me at this point because you don't that was just a bunch of words that I put on there without that explanation, you know?"
Yeah, wouldn't it be better if you could do like with our app, you can actually just take a picture of the pill bottle and it will upload the whole thing in. And so you don't have to type all that stuff. You can just take a picture, take a picture, take a picture, and boom, 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 it extracts the information and puts it in where it's supposed to be.
You're gonna change the world because I was writing brands, and that's what got so wearing out. You're gonna change the world. I mean, that's gigantic, especially because it can have all of that. Get the milligrams, get the dosage. You're getting the actual full picture to be able to make a determination. I love it. I really love it. On the flip side, what feels frustrating or inefficient, especially when it comes to operations, lead flow, or follow-up?
I think the most inefficient or most frustrating thing for me, honestly, is as a entrepreneur, you spend a lot of time fundraising and, you know, I've built big companies, but they've always been in the sort of healthcare world where part of a health system, whatever. And so fundraising was not something I ever had to do before. And so I'm learning a lot, but it's just a frustrating, inefficient process. And you see people getting big money for ideas that are small minded, I would say. And you see people who have amazing ideas finding it very difficult to raise money because the friction is just incredible. And so I would say that's the most frustrating part for me is trying to trying to navigate that process. Yeah, I think that everything else pretty fun. I like building teams. I like building the product. I'm not a salesman by nature, but I love selling this because I truly believe it could change the world. So, yeah, I think that pretty much everything else I really enjoy about the sort of entrepreneurial life right now.
When you try to find fundraising, what avenues do you go down? How do you find people that would be investors? Is it through grants? Is it through how does that work?
Yeah, you reach out to venture capital and to family offices and to there's a lot of ways and you reach out directly, but I found that I don't have time to do all of that all the time. So, so you hire people who reach out on your behalf and, get you set up for meetings and sometimes sometimes they're a good fit, sometimes they're not, and I laugh and say you have to kiss a lot of frogs to find your prince, and that's sort of the process for the most part.
Do you feel that there are opportunities today where potential customers are slipping through the cracks?
I think there's a lot of fear still in the medical community about AI. I think there's a lot of people with their head in the sand that think, ah, it's just a fad. It is not a fad. It's here to stay. And most of them don't understand it yet. And so there's that. And then there's the fear about losing jobs. And there's also the fear about privacy and other things like that. We're trying to make sure you know, that we make it clear that we're protecting all of those things as best as possible. But I think, yeah, I think fear is the biggest thing that causes potential clients to slip through the cracks because you talk to them and they go right to the place where their fear is rather than seeing the potential. If you can get past the fear and they start to see the potential, suddenly you have much more productive conversations. So we're trying to figure out how to make it the least, seem the least intrusive as possible, seem the least intimidating as possible. But that I'd say that's the biggest challenge.
What advice would you give to someone who wants to become a CEO or a founder in healthcare or well-being?
I think whether it's CEO or founder, it's sort of be careful what you ask for. But I think the advice that I would have is do as much as you can to gain the skill sets you need before you go out and try being a founder. Make sure that you know a little bit about HR, make sure you know a little bit about finance, make sure you know a little bit about, IT. Because when you put on that founder hat, you can buy that expertise, but that's expensive, right? And so you got to know a little bit about everything. I'm lucky. I've run big organizations. I've had to run all aspects. And so I have pretty wide variety of things I've been responsible for in my career. And so that put me in a good spot for it. But the other thing I would say is just perseverance. Like you will get to the point where you've mortgaged everything you have and your credit cards are all maxed out and you think it's going to fail. And when you get to that point, you got to just keep going. And, there is a point at which it breaks open and starts to really move. But boy, it can be super stressful. So just be prepared. Like it's not, fun and games and it's not all rosy. You have to be willing to persevere and push through.
That's awesome. If you could go back and tell your younger self some piece of advice in starting this journey today, what would you do differently?
Not very much, honestly. I mean, mostly I would tell my younger self it's going to be a hell of a ride, but enjoy the peaks and don't worry too much about the valleys because life has a lot of curves, both up and down and to the side, and you just gotta, keep on going and enjoy the fun. Like, make sure you enjoy the moment. The only, so this is going to sound crazy, but really, there's very little I would do different in my life. The one thing I would do different, I skipped a year of college because we were poor and I was trying to save money. In the end, that was a spit in the ocean compared to all the other money that I spent on medical school and whatever. And so, like, if I had to do over, I would take my senior year and I would have not taken so many hours and I would have played in the marching band and done some other little fun things, but I mean, there's really not much. Like, life is great. It has bad times, but you have to live in the moment and you have to look for experiences. It's not about things, it's about experiences. And if you treat life like that and really revel in the experiences, whether that's family or whether that's sports or whether that's travel, like whatever it is that you love to do, like revel in those moments, right? Because we all have the humdrum, but life is about experiencing those moments and savoring them and holding them near and dear to your heart.
Absolutely. I could not agree with you more. What's the biggest win that stands out in your mind over the last 5 to 10 years? The
Biggest
biggest one.
win? I mean, if I go back 10 years, I would say I built a really awesome medical group that's still doing great things in the Cincinnati marketplace. And I'm super proud of them and I'm super proud of what we built. Probably the biggest win of my career. If I am just speaking in the sort of lately, I would say the biggest win was when we first had a conversation with the AI doctor and it sounded like we were talking to a doctor and we were like, wow, it worked. That was an incredible high as well.
That's actually amazing because a lot of times AI does sound like AI, and you can tell when it sounds like.
Yeah, when it was asking the right questions, we were like the 3 founders were all physicians, and so we're critical, right? And so we were like, "Hey, I think it's an A. It's at least an A minus. Like, that's amazing." Like, so and we were not expecting it.
That's
Yeah,
amazing.
it came faster than we thought, and so that was a very big high.
Yes, of course. Looking back now, what's the biggest thing you've learned from that experience?
From this experience, I would say the biggest thing I've learned is don't get too high and don't get too low because that was a big high. And then there was another very low valley, right? And so, like, you've got to just keep pushing along and keep persevering. I think that's the biggest thing I've learned through this experience, different than maybe the rest of my career.
You're used to making decisions of great magnitude and solving problems. What are you most focused on
Uh,
right now?
Most focused on getting it into our first set of clinics at scale and really proving it out, doing some research studies and some things like that to really be able to not only just tell the world myself, but to say, here's the data. Here's the data from the practice. Here's the data from a study we did. I'm excited to be able to eventually then, you know, take that directly to patients. For right now, taking it to doctors and giving them the tools that they need to be able to scale, I'm over the moon about that.
Absolutely. This has been an incredible
I've really enjoyed it. You're
conversation.
a great host.
Thank you. I appreciate how open you are in being able to communicate the whole journey. Like it's been a very natural, easy
Yeah, it's great.
conversation to have.
You're an easy host to talk to, and you ask great questions, so I appreciate it.
How can people get in touch with you?
Yeah, so you can get in touch with me either on our website, which is queryhealth.ai. I think .com was taken. So QUERY health.ai. Or you can get me on LinkedIn and I'm just Glenn Loomis MD. GLENNLOOMIS MD.
Thank you so much for being a part of the show today. This has been absolutely fantastic. And I wish you the greatest success with it because it's world changing. Thank you, everyone. That's it for today's episode. Thank you for joining us. And if you got value from today's conversation, please like, share, and don't forget to subscribe. We'll see you next time on Ascend Growth AI Podcast, where we mix smart growth moves with a little AI magic.